In room D, on the tube, we have collimation and our buttons, which are all of our locks. We have a longitudinal lock, which allows for movement to the length of the table. Transverse lock, which is side to side on the table. The vertical lock, which is for SID, or source image receptor distance. We have another button for angulation. We have DET, which is detant, which is electronic alignment buttons to help you for alignment purposes with SID and with transverse alignment. In this room, you must depress the button, whichever one that you want to work, and then grab the handle and squeeze in order for the lock to release. I want to go to my vertical detant. I'm going to select detant. I am going to hit vertical and move the tube up until it locks in place. Until you put an image receptor in the bucky, you will not get a green light. It will blink yellow. For transverse detant, to assure that you're in alignment from side to side, it should lock in place, which it has, but look at the ceiling and you'll see a green light, which tells you that you have transverse detant, which means when the image receptor is in the bucky, you will be aligned to the center from side to side. We're going to take our image receptor, we're going to place it in the bucky. This bucky is slightly different than the other lab. To release, you lift the tab, pull it away. We have on this image receptor a center point. We're going to align that with the center of the bucky. Push until it is gripped and lock. If you touch the image receptor, it should not move. In this case, we push it all the way in and you'll hear it move. And if we look back at the tube, we have a green light indicating that we're at a 40-inch SID. For collimation purposes, we have a 10 by 12 at 40 inches, and this is automatic collimation, and you can see the light field on the table. You'll notice that the bucky is not aligned with the tube. At this time, we will use the longitudinal release and we will move the tube until it aligns. And you can see the light field alignment. Now, this table also floats, and you will float by deactivating the lock by stepping on the free float lever. The table will come towards you, move away, or you can move it longitudinally. If you chose to move the bucky, you would grab the handle on the bucky device, press the lever, and you will be able to move the image receptor where the body part is. If you want your patient to get on the table, we can lower the table by activating the motor. We will take the table down and we would bring the tabletop closer, and the patient could proceed to get on the table with ease. Once you have your patient on the table, we will bring the table back up to a work height. In this case, we'll bring it so that we have a 40-inch SID. We're moving to the upright bucky now, so we're going to bring again the tube vertically down so that we can move it without hurting ourselves. We want to turn the tube, so we must hit or select angle, and we're going to tube the tube till we are at 90 degrees. Now I want to move the tube towards the upright bucky. So I have longitudinal since I want to move in that direction. I can take the vertical off at the moment. Now I am going to use the bucky, so I am going to select detent in order for us to lock into place. Oh, I won't buy it, Brad. How did you let me do that? The green light will not activate until an image receptor is put in the upright bucky tray. Bring the upright bucky tray to a working height. The handle on the side, squeeze. It releases the lock, and you can bring the upright bucky down to the level that you need. We're going to take our image receptor and we're going to place it in the device and centering it to the middle. You'll notice that we have a metal clip that will go in place. You must know the size of your image receptor. This is a 24 by 30. So we're going to place our device in 30 to hold it in center. Again, push until both clamps are tight and then lock. The image receptor is locked in place. When we push the image receptor in, you must push it all the way in order to activate automatic collimation. Then you may turn the light on to see where the image field is. We will use the vertical button to bring the tube down into place and align. To assure no movement, release all locks. And you will notice that we have a green light, meaning that we are at a 72-inch SID. We are ready for an exposure.